Well, when I first got involved with pain education, it became very clear to me that there were about between 4,000 and 5,000 board-certified pain experts in the country. There are about somewhere between 70 and 100 million people with chronic pain. And what that led me to understand was the fact that most of these chronic pain patients are going to be dealt with by people who are frontline practitioners in primary care in most cases. And there wasn't a lot of dissemination of information from the experts to the primary care people and the non-experts. And there are 1.4 million of them. So as far as I was concerned, the experts were a negligible group. And it became very important to me to become a bridge of information from the experts to the people who are the non-experts. And that's really where I live. Almost everything I do in one way, shape, or form is intended to help transfer knowledge to the people who are bearing the brunt of caring for patients with chronic pain, but don't have the expertise, don't have access to the resources, and I try to help them figure out how to navigate this. Sure, so one of the ways I helped them navigate it was I developed the single largest non-promotional pain education resource on the internet. It's called painedu.org. When I got involved with it, it was originally run by a company up in Newton, Massachusetts called Inflection. I consulted for them. They had about 3,000 registrants, and our relationship ended last year, but when it was over, we had over 80,000 registrants. So we cultivated a large audience. Some other ways that I've been involved with this, promoting this education, is through National Institute of Health research grants, developing educational programs for both patients and healthcare providers. I have also received a grant from the Food and Drug Administration's REMS education program. I worked with Albert Einstein Medical School in Montefiore in Bronx, New York, to develop a REMS education program for 1.5 years. So in many different ways, I've been involved in one way or another in education. And at the medical school, I'm proud to say a couple of years ago, I introduced an elective for the medical students entitled Pain, Drugs, and Ethics, because it's a very hot button topic right now. I don't think many people, unfortunately, think about pain without thinking of the issue of drugs and substance abuse. And the elective fills up in a matter of hours. And I am now developing a full-fledged curriculum, full semester course on pain at Stonybrook Medical School, which we're hoping to get off the ground next year. It's noteworthy to know that only 4% of medical schools in the United States have a pain curriculum at all, despite the fact that pain is the single most common reason that people seek medical attention, more than heart disease, diabetes, and hypertension combined. One would imagine that if pain is that prevalent, that all of this would be in place. But when you look at curriculums in medical schools, it's like any place else. Everybody's fighting for the space, and people are actually looking to cut curricula. And while pain seems to be on the top of everybody's mind over the course of the last 15 to 20 years, it really doesn't have a lot of backstory behind that. So it's relatively new to the scene, and even the professors haven't received a lot of education in their training. And as someone who teaches medical students, I can tell you, you like to teach students what you know. So we have a situation where the majority of people who are non-experts who are teaching medical students today haven't been taught themselves. So it's sort of fallen to the wayside. And one could make the argument that part of what the problem is today with the opioid epidemic could be, at least in part, from the lack of a good educational foundation of healthcare providers today. And it's also worth mentioning that these same statistics apply to nurses and nurse practitioners and pharmacists. Even pharmacists don't really get adequate education regarding pain management. So we need to make a lot of headway from the educational perspective with the young people. Teaching the old people is the new dog old trick phenomenon, but what we really need to do is instill it in the young people and make it like seatbelts for them.